welcome to the Nomad Doc Healthcare Stories. So, on this episode, we will be talking to one of our guests. She has kindly agreed to speak to us about her chronic health condition and how she manages this around travel. So, I will introduce to you Abimbola, and she's going to tell us about her journey with living with chronic kidney disease. So, over to you, Abimbola, if you're able to tell us a little bit about how you found out about the diagnosis of chronic kidney failure and how you've managed it so far.
Good afternoon. How did I find out? That's a tricky one, actually. Person, I just found out that I normally get a bit tired, unusually tired, or like how I used to be, and I first noticed that my legs were getting swollen, and I noticed I couldn't really wear the shoes I'm used to wearing. There was a particular shoe that I liked, that was covered in front, but it's opened at the back. I found out that I ended up wearing that more than other shoes, and I just couldn't wear, any other shoes, and I just thought maybe I was stressing myself. But I happened to have an appointment to see my consultant within like a space of a week and a half. And then I had a cousin that was on holiday from the States, and I was going to take him shopping. But I said to him, "Look, I can't miss this appointment." So we went together. And then when we got there, immediately the secretary saw me. When someone is used to you, I didn't notice something was wrong with me. But because she knows me and she just saw me and she said, "There's something wrong." And I said, "What's that?" And she said, "You don't look good." I said, "What do you mean by that?" She said, "This is not your normal." I said, "Yeah, yeah, I'm just a little bit tired." And she said, "Aside that." Then I said, "You mean my legs?" And then she said, "Yeah, yeah." And I said, "Oh, that's just, I've been stressing myself. That's just like in the last 1 week." And then she said, "No, no, no. You can't run away," because I was trying to actually change the appointment to change it to another day because I had something doing. And then she said, "No, no, no. I need to make sure he sees you." And then I had to wait around. And my cousin being kind of in the medical line as well, he's a microbiologist. So, and I've been saying to him, "This is the," and he said, "For them to say that to you must be really important." So, and by the time he came out, he looked at me and he said, "No, we got to admit you." And I was, "Admit me?
Oh, wow.
You've not even tested me." And he said, "No, I know what I'm saying." But at that time, I'd been, diagnosed of lupus. It was just lupus. It was treating me
Okay.
for lupus. I hadn't started the lupus clinic, but I was being seen in hematology because it was under hematology. So, and they were already working me up for lupus clinic. So it was just like, "No, no, no, no,
Okay.
that we got to check if something is going wrong. And then that's how I got admitted, and they started acute dialysis and trying to see if they could salvage things, but unfortunately they couldn't. So
Yeah. Yeah, I mean, that's a very interesting story. And, so many things that you mentioned there that I would like to just highlight. It's that often we always excuse away things, symptoms, because there's always priority. And this is very common, especially for us as Black women. There's always something else that needs attention. And listening to your body is not something that we'll find as an innate skill, so to say. And it takes somebody around us to sometimes highlight those things to us. Do you mind me asking, how long ago was this diagnosis?
this was in 2003. I was
Okay.
diagnosed 2000 for lupus. Yeah, yeah, I haven't started the clinic because they were still trying to see when I first came into UK. And actually what was diagnosed in Nigeria was a kind of cancer, Hodgkin lymphoma,
Oh, right.
and had actually taken
Oh,
two
wow.
courses of chemotherapy. And then when I got
Oh,
here,
wow.
they asked for the slides and all that, and they eventually ruled it out and said it was lupus. But I think I just have this, I don't know, this strong will thing and kind of like a superman woman thing.
Yeah.
And I'm never really put down at all. I'm always
I think we so many women do that because that's almost how we're brought up, really, isn't
So
it?
they
Um,
didn't actually get me pinned down for lupus clinic and all that, but they were managing me. The hematology was managing me, and rheumatology. Those two
yeah,
departments were managing me. So I was seeing both departments until that happened in
yeah,
2003.
yeah,
Yeah.
yeah. And it makes sense, as you say, because if the initial query diagnosis was Hodgkin's lymphoma, that the hematologists were seeing you first before the rheumatologist got involved. So tell us, how have you navigated managing your health when you are outside of being in the UK? For whatever reason, whether just leisurely holiday or for work or for other reasons. How do you manage? Because what's your care management plan at the moment? I can see you've got your dialysis machine in the background there. How often do you have dialysis normally during the week when you're in the UK, and what do you do when you're away from the UK normally?
Normally, I try to stick to like every other day, because it's also believed that when you have home dialysis, that gives you the liberty to have more
Yeah,
dialysis, have a close to a normal life. So every other
yeah,
day, and sometimes, it's not that easy to sit down, because when you're at home, they expect you to do, longer hours, so you could have enough,
yeah,
clearance and all that. But if you are doing like 5 to 6 hours every other day, it's not that easy.
yeah,
There's sometimes you just don't want to, because normally when you go into the hospital, it's 3 days a week, because it's like within the slots, you either have a slot of Monday, Wednesday, Friday, or a slot of Tuesday, Thursday, or Saturday. So which is like 3 days a week. So when you're at home, they don't expect you to do less than 4 days. So
4 days
sometimes,
a week.
yeah,
Okay. And how would how do you normally fit this into your day? Do you do it at night just before you go to bed, or
it's,
where does it fit into your day
yeah,
if it's 5 to 6
yeah,
hours?
I try to do overnight. So probably
Okay.
sometimes I go to bed for like 2 hours, and I wake up, I start between 12 and 2, and then I finish early hours
Okay.
of the morning. But other days that
Okay.
I'm very, very strong, and that
Yeah.
I'm not that tired. I just do it
Yeah.
anytime from like about 6 in the evening or something. So, well, most
Okay.
times it's always
All right.
night, because
At night time.
yeah,
And do you set it all up yourself, or do you have somebody to help you with
it's
connecting
all
you to
done by
it?
myself. I do it myself. I had to do the training for
Okay.
6 months. I do everything
Yeah.
myself, the lining the machine and all that. So I take myself off. But the
That's all.
community nurse comes in like every once in a month to take the bloods.
Okay.
So it's
Okay.
like so I try to do 4 days, but sometimes you're allowed actually to do 3 days, because you do longer hours
Okay.
than those that go into the hospital. That's just like an advice,
Yeah.
but because you're already doing more days like than other people. Because people that go into the hospital do
Yeah.
4 hours, and you are doing 5 to 6, so you're already doing more, but they just
Yeah.
feel that, that's it's more beneficial since you're at home. So but when I
Yeah.
have to probably travel, I push myself, and I try to do like the other day, stick to the every other day before I go. And then I try to dialyze the very
Okay.
day I'm traveling. I try to dialyze on that day.
Okay.
So I already have that day off. So it's technically, if I'm going to be away, I try to be away for like 2 or 3 days. I know that if it's somewhere within the UK, then you could arrange, the
Yeah.
hospital to get somewhere for you to dialyze. But if it's somewhere
Okay.
where I'm not going to get dialysis done or something, I can't go for more than 4 days, maximum 5 days.
Okay.
So you know that as soon as you're coming back that very day, you just have to plan it that you have to dialyze that day. Because, for
Okay.
someone like me, I know how to control my weight, and which is the most
Yeah.
important of all. As by eating, you know what to eat. You
Yeah.
know what to eat.
Yeah.
Yeah.
Yeah, which can be hard, especially when you're on holiday and you don't have as much control over your diet.
Mm.
So there was so much you said there that I really wanted to unpack. So you've had to get yourself trained so you can start and do the dialysis by yourself at home, and you're doing it at night sometimes, which sounds like it may be interrupting your sleep as well. So it's probably got some impact from that perspective. I don't know if you're able to share about that.
Yeah, there was a time that I had issues with sleeping, so I would say probably if it was around that time, would have really had a great impact. But now, once I'm tired, I'm tired.
Yeah,
I sleep. But
fair enough.
I'm still kind of like a light sleeper in that after like,
Okay.
I think it's with everybody. First 1.5 to 2 hours that you knock off, you might not know what's happening around you, but after 2 hours,
Mhm.
anything that happens around me, I sure know. I might not just be concerned because I just want my sleep,
Yeah,
but every pin, if a pin
yeah,
drops, I know. So we says because I'm conscious of the fact that I'm having a treatment, though I sleep
yeah,
not that deep in sleep, maybe the first 2 hours, and I know I'm doing 6 hours. After that, I find myself
yeah.
waking up every 30 minutes until I'm done. So
Right.
I try to like have like an hour to 2 hours sleep after the treatment to rest. But that
Okay.
is if I don't have anything doing. If I have anything doing,
Yeah.
I go off and do what I have to do, then come back and then make sure I get in and have an early night the day after. But there's some
Okay.
times that you just finish and you're just really knackered out of this world. On the seat
Yeah.
there, as soon as I finish and get myself, I find myself dozing off for the next probably 45 minutes or an hour or something, depending on how tired I
Okay.
am. Yeah. Especially maybe
Yeah.
sometimes when I travel and come back and I have to dialyze like that. I'm just so tired
Yeah.
afterwards. Yeah.
So you mentioned earlier on about the hospital helping to organize when you're in the UK another dialysis center in the city you're going to. How easy is that process? Is that something you can shed some light on?
Um, It could be easy and it could be difficult depending on the city you're going to, depending on how
Yeah.
busy that city is with tourism,
Yeah.
and depending on the availability at the hospitals there. And some places you go to, the dialysis centers are far away from maybe where you are going to.
From,
Like, for instance, I remember
yeah.
2003. I went for a childhood friend's 58th in Ireland, and all the
Yeah.
hospitals around the county where she was, they were all fully booked. There was nothing. So at the end of the day, I
Wow.
could not realize at all. So I had to take a risk going away for that 4 days. I'm planning to come back and just
Go
dialyze,
straight to that. Yeah.
yeah. So
Yeah.
I ended up not because they
Okay.
couldn't find anywhere for me. I tried on my own and then they tried as well. And we couldn't. She was
Okay.
even advising that if I get somewhere in Dublin City, she could drive me down and all that, but there was nowhere. It
Yeah.
was all just up.
Okay. And when you said you tried yourself, is there a website or somewhere, or you literally just pick up the phone and call
Yeah,
a dialysis?
I googled and tried to call, wrote out the numbers, but they have a website where they try to get people in. Like, for instance, I've got a school reunion coming up next month, and obviously that one I'm
Okay.
going to be away for like 7 days in Turkey, and they organized all that because I had to give them ample time. I think we've been on it now about 4 months now, and they've gotten somewhere. They
Okay.
sorted it out. I had to fill a medical form, and they sent a
Fantastic.
medical form
Yeah.
to me to have an idea of all the questions and all
Yeah.
that. But my consultant or the community nurse
Yeah.
had to fill it, and they've done it and sent it back to them. And I remember the email I got last week, and she was saying she was coming for bloods because she's got to do the bloods a month before I leave. So she's coming for that
Yeah.
next week, and this week actually. So because I'm doing end of the
Yeah.
month.
I said it sounds like a very positive outlook that they were able to organize that for your upcoming trip. So talk to
Yes.
us about when you've gone to somewhere like Nigeria, how you've
Yeah.
been able to navigate.
Nigeria as well, when it comes to the international one, because it's international, they leave you alone. to find the place. All they get involved with is trying to know if it's the same machine. If it's the same machine, all
Yeah.
they can do is because it's home dialysis now, so it's easier. So if you think you want to take any of the things you have here along with you, but knowing Nigeria as it is, you still pay for everything even when you take them. I remember when I just started in um 2003, the very first time I was going to go to Nigeria then, and I had to go for my dad's birthday. And then in those days, NHS used to still help with a lot of things. They gave me everything, and I took them along. They wouldn't want to use it because they said, "Oh, you paid for it," because they will still get the money. Nigerian factor, they get the money from you. But at the end of the day, I had to insist that I want to use what I brought. But because they gave me
Yeah.
more than enough, had so many left, and they were asking me, that what do we do with them? I said, I'm not going to take them back. It's already here. Use it to bless somebody, because it was like an eye opener to me. I saw so many people. It was a strange thing for me when I started, because I maybe I've heard about it frequently, people having dialysis, but I've not actually experienced it. And I didn't know I was going to be in that situation. So being in that situation, being grateful that I was in this part of the world when it started, and then getting to Nigeria, seeing so many things, seeing people that couldn't even afford to dialyze as often as I was, people having to do just
Yeah.
once a week because they can afford it, or
Yeah.
twice a week. And I remember there was a particular guy there, as we call it back home, that Megad, he was a gate man to a man. But you know how the house of people
Yeah.
was, his um, boss was gracious enough to be paying his bills. But when you do something for someone free, some people don't even appreciate it. The guy wasn't really grateful at
Mm.
all. He wouldn't come for his dialysis on time. He was always getting overload because the nurses were, how the nurses, talk. They were like, he's always coming in overloaded. So there was a particular day he came in and was so gasping for bread. It was short breaded. It was overload. And they were like, oh, and he said, oh, it's my master that puts the water filter, that he's the one that put the water filter in his room. So they said even if he puts it there, doesn't mean that you have to be drinking and drinking. We've, we've told you about how this thing is. You shouldn't. We're not saying don't drink, but you have a limit. Don't drink too much. But he's always drinking. So when I saw people like that, and I saw other people coming in and they're saying, "Oh, can I do this day, this week? Next week, I'm going to do just one day or 2 days." I was like, can you use it to bless people, And I remember my mom
Yeah.
saying, oh, you're just saying that to them, they're not going to do it. They'll probably use it for themselves or even resell it or something. But I cared less,
Yeah.
Mine was just like, use it. That
Yeah.
was it.
So you touched on a few things there. Educating yourself so you know what works for you. You touched on having consumables that you have to carry with you when you're going on holiday. I'm sure, for those of us who travel to Nigeria, the weight of our luggage or suitcases is always an issue.
Mm.
So, so I mean, are these challenges potentially for when you're traveling somewhere where you have to factor in the weight of the consumables that you use for your dialysis to where you're going to?
Within Europe, I remember when I called
Agreement.
the number at first to initiate the arrangement and all that. I remember the lady said to me on the phone, in Europe, you're saying that in
Yeah.
such places, for instance, the bloodlines we use, they're made in Turkey.
Yeah.
So she was saying to me
Mm.
that in Turkey itself on its own, they have three major ones in within all their cities. So that it depends on where I'm going to. But at the end of the day, when I give them the details for the hotel and all that, they were like, "Oh, we
Mm.
have one that is like wasn't too far from the hotel anyway," and
Yeah.
they were going to organize the transfer
So
and all that. So with that one, I don't have to take anything because the bloodlines are
yeah.
made there. It's the same machine, the same model, and everything. So they've done everything.
Okay.
But just to be on the safe
Okay.
side and being the kind of person I am, for like my dialysis line, changing packs, I would want to still take
Yeah.
extra bits along, not too much because I
Just
booked only for 2 or 3 sessions for that 7 days because
yeah.
obviously I'm going to dialyze the day before I leave. So I might
Yeah.
take two or three along just in case I'm not happy with what they
Yeah.
have there to change.
What they
But I'm
have.
not going to take the
That's
bloodlines and
great.
all that because it's made there, so it's going to be the same thing. And I'm not going to be carrying that load.
Okay.
But obviously, even Nigeria that I went to last year when I went for my son's wedding, I did take some few things, but I ended up not using it because I
Mm.
paid already. It's not the same machine. I used a different
Yeah.
hospital this time around because they
Okay.
said it was a new hospital. They were good and they were top
Yeah.
notch, for dialysis and all that. But it wasn't the same machine, so I just had to use theirs, all they had. But even the
Yeah.
changing packs that I took along, though I insisted they have to use my own, they used part of my
Yeah.
dressing, but they still have to use their own dressing to cover it,
Stuff.
which I think was one of the things that, affected me the more with the sepsis that I had that I arrived with because
All right.
because everything was covered. We don't cover the dressings like that here because they always believe that they have to
Mm.
see through. We use a see-through gel
Yeah.
thing. The gel is to protect,
Yeah.
from infection.
Yeah. The
And then the
lines.
see-through is to see if
Yeah.
something is going on with your lines, but everything was covered. It was like
Yeah.
a plaster that they were using. And I was trying to say to
Yeah.
the guy, I'm not used to this. To say, well, we use it for all our patients. I don't know why I even agreed, but I didn't
Mm.
initially. But later on, I had to because what I went to ran out because the heat in Nigeria. I think I should have taken extra
Yeah.
bit more of it, but because I was going with the knowledge of the last time when I went for my dad's birthday when I first
Yeah.
started, knowing that they will always want you to use theirs. But I didn't know it was going to be a covered one because they didn't use the covered one in
Yeah.
St. Nicholas when I went. Though it was different as
Yeah.
well. They didn't have the gel, but at least it wasn't covered. But this one was covered like a plaster. So I think
Yeah.
just aggravated the whole thing.
Yeah. So you kind of answers a lot of the questions I was going to ask you next, which is about the limitations when you're going on holiday. So there's the planning ahead for finding a center.
Yeah,
There is finding the center that has compatibility with all the lines, the connections, the dressings, and everything, and the machine itself actually, because you're not carrying the machine
yeah.
yourself when you're going on holiday because it's quite bulky. Then there is, how do you manage if you have sepsis? As you mentioned that you had sepsis, at what point did you realize that you had
I
sepsis?
didn't
Was
even
that whilst
notice.
you were still in Nigeria or when you arrived back in the
When
UK?
I arrived back, I didn't even know what sepsis I had. All I just know was that I had this
Right.
constant backache, really, really, excruciating
Mm.
backache. And I just thought, the way we work here, because I was working part time then before I traveled, I just felt that I'd overworked myself going to Nigeria for
Yeah.
a wedding and having to go to Nigeria. You just have to make the money first for your medicals. You have to pay over there before you
Yeah.
make the money for the wedding.
Yeah.
So, and everybody was
Yeah.
blaming me because I had just a day in between. I traveled out on a Tuesday morning. I still worked. I did a 7-hour shift on a Sunday after church. I did a late shift. It
Mm.
was only Monday that I had without working. So everybody thought I had overworked myself. And I thought that as well. And
Mm.
I just know that I woke up on a Monday morning and I woke up with this bad. It actually started before I left. But like I said, always having this strong will, like a superwoman. I thought I'd overworked myself and I
Yeah.
thought, oh, when I rest a little bit, I'll feel better. So I went back to bed
Yeah.
thinking that after resting, I actually felt better and I went to do last minute shopping. But before I ended up the shopping, it started again in the evening, and I still thought, oh, I haven't rested enough, and I traveled like that. I got to the airport
Mm.
that morning. I was feeling okay, but by the time I stepped into the airport, wheeling the trolley in, it started again, and I found out that I needed assistance. Got assistant, thinking that
Mm.
I'll get to Nigeria, rest very well. But every single day in
Mm.
Nigeria was just getting worse till I got back. I don't even know how I
Yeah.
survived. How the
Yeah.
planes took me, the aircraft, I don't know. I just think it was just a miracle. That's all I can talk
Yeah.
about because leaving
Yeah.
UK on its own itself, getting on a plane, I couldn't even really walk. My legs were wobbling and I was tired. But like I said, thinking I would rest, they had to use the ambulance to lift me to the plane, leaving the UK
Mm.
from Manchester.
Wow.
It was okay from London because I mean they didn't have like the step thing. So, and I got assistance.
Yeah.
They wheeled me with the wheelchair, but by the time I was coming back, I just noticed that the very day I was coming back, I lost mobility. As I was going down the
All
staircase
right.
to get into the car, I was just sleeping on the staircase, and I didn't even realize it myself. I just thought I was trying to hang out until my son was shouting, "Mom, mom, you're sleeping!" And I don't know how that boy did it. He practically like carried me, you know, and into the car. By the time we got to the airport, getting the wheelchair and all that, and getting to Manchester Airport before I just collapsed. And by the time I opened my eye in ICU,
Wow.
I was being told, "Oh, you have
Wow.
nasty bug, it's sepsis, blah. You're really lucky, all sorts. It almost got into your bloodstream. It's affected your body system." It was just like, my God, because obviously I know what sepsis is. I didn't realize that was what it
Yeah.
was. So
Yeah. So do you think the infection started before you left the
I
UK or it
think so.
started whilst you were in
I
Nigeria?
think I think it got worse while I was in Nigeria, but it started before I left. Before because that's when I started having a
Okay.
backache. But by the time I got to Nigeria, it was just
Okay.
getting worse. I just noticed that when I wake up in the morning to even get myself off the bed was a problem. I could spend almost 2 hours getting out of bed. It was like holding me from the waist to the neck, my neck area and everything. And that's why they had to do, I
Wow.
mean, the spine and neck operation and all that, saying that the bones around the neck had chopped off, being a renal patient and all that.
All right. All right. So basically, it sounds like you had what we will call an abscess, which is like a collection of infection, osteomyelitis as well. Okay, but thankfully, it sounds like that was all caught in time and treated on time, and you're
So
obviously
that
back on your feet. Yeah. So thinking about that experience and thinking about possibly if the culmination of all the symptoms happened when you were in Nigeria, did you have a plan when you were going to Nigeria of where you could be looked after if you had any complications at all?
finally, I didn't think I was going to have any. I did not.
Yeah.
I just
Is that something? Is that something you would normally look for to say, okay, if I'm going on holiday somewhere, this is where I need to go to. This is where I want to be looked after.
definitely after this, experience, I think so. But I've never in my wildest dream thought that because
Yeah.
being a renal patient, I know definitely that even if I go to somewhere like Nigeria, I know that I could never stay for more than 2 weeks because you have to think about the expenses as well. I mean, the
Yeah.
longer you stay, the more you spend. So obviously, I don't want to find myself.
Yeah.
I always have to plan my trip to be there for
Yeah.
what I'm going for, achieve what I'm going for. And even if I'm thinking of a holiday to spend with family, maybe an extra 3 days with it.
Yeah.
That's why it's stretching to 2 weeks.
Yeah.
If not, it would just be like bam,
Yeah.
going in for what you're going to and coming out. To some other people, it might sound crazy that you're spending so much for just like 3 days, but I mean, if you're going to go and
Yeah.
you know you're going and you know that you don't want to put your health at risk, so you're not thinking that you would ever
Yeah.
end up. But at the same time, even when you want to
Yeah.
dialyze or whether you want to use a good hospital, so that if anything even happens, which was why I chose where I went to as well,
Yeah.
you want to use a good
Yeah.
hospital that what anything happens, they could stabilize you to get back to where you're coming from. So
Yeah. And so, do you mind me asking for one session of dialysis, what is the average cost that you've had to pay? It doesn't have to be in Nigeria, but if you have an example in Nigeria, that would be helpful too for our listeners.
Nigeria, obviously, it's anything from like the first initial one is always expensive because no matter what happens, you've always got to do registration like a fresh patient. You pay for the registration
That's correct.
after having this hospital card. Even if you use them, maybe for someone that you used before, they might not get it again. But I didn't go back there. I went somewhere else. So definitely you have
Yeah.
to pay as a fresh patient because I paid over there as well. So initially the first time I went there, so you've got to pay,
Yeah.
and so it's more expensive. Then another thing I found out, which I didn't experience the last time because obviously I didn't have that option. Was that, if you do night dialysis, they calculate it as being nocturnal dialysis and you pay more for that.
Yeah.
But because I didn't have to do that
Yeah.
the last time, the first time I actually went, but because I got that option here, but I wasn't thinking that they were going to do that. But when I found out that I could, and because obviously I do night dialysis
Yeah.
at home, I opted for it so that I could have
Yeah.
more time to do some other pending things I had to do during the day. So,
During the
and then
day.
they were like,
Makes
"Oh,
sense.
you've got
Yeah.
to pay more," and I was like, "Well, I've got no choice, so you've got to pay more."
Yeah. Would you normally have medical insurance on top of your travel insurance when you're going away?
Um, I have never taken from Nigeria, but I do take, when you go to obvious most European countries, you even
Other
ask you for it,
places.
especially the Schengen countries, they ask you for it. But obviously, if and there's another thing that you have to think of, being Nigerian factor, you think, oh, you've paid so much and you're spending so much. And you know
Yeah.
that nothing comes cheap in Nigeria. You'll be thinking, oh, to come and add insurance.
Yeah.
But I mean, with the experience I had, everything is based on the experience that one has had. I think I
Yeah.
would, but obviously I'll be looking for something that is really, really affordable, not like
Yeah.
break a bank insurance thing. But now with what
Yeah.
happened the last time, I think, but I've never thought of it because what I think I would
Yeah,
now.
consider it. Yeah. So just to summarize all the things you've kindly shared with us, you shared with us to first educate ourselves on ourselves because that's when you're able to recognize signs and symptoms that are different to normal for you. Then using that health education to advocate for yourself. So, for example, with things like dressings and what your normal management plan is, learning to also know how to look after yourself. So as you've learned how to, do the home dialysis yourself, um, and then planning your trip, like you mentioned about your upcoming trip and how you've managed to secure somewhere close to your hotel. I mean, that takes a lot of forward planning and organizing and everything else. And just with a chronic health disease and the financial impacts that has, the personal impact it has in terms of how you plan even family activities, as you said, your dad's funeral, your family wedding, all these things that really should be non-negotiable, and having a chronic health condition should not limit you from being able to be present at these things. So when you think about all the things that you kindly shared with us, what would you say is your takeaway, and what would you advise someone who has any chronic health condition, for example, who is planning a holiday, in particular to Nigeria or going anywhere else?
Mm,
What would you recommend that they do to plan for a safe trip for themselves?
this time around that I actually went as well, I also took a great risk in that I never took the malaria, but I don't think that's what affected it. Not that I didn't want to take it, but I think I left it too late this time around because, like, right now, I live up north. I live in Manchester. I used to live in London. When I was living in London, probably I was used to the pharmacy, and he knows once I just say I'll be
Mm,
traveling sometime, he tells me the range of time to, which to me it's always like about 2 weeks before, which was the time I approached my surgery here, and then they said to me that
mm,
I had to give them a month's notice. How can I give you a month notice when I have 2 weeks left? So it was crazy. And then they started advising me, go to this, go to this, go to that. And I actually went to a chemist around me, and the amount they were asking me to pay was just too ridiculous. And going for something like a wedding, I just couldn't just afford to pay that at that time. And I said to myself, I'm going for
mm,
2 weeks, top most. I have other vaccinations, I have everything that should be. So I'm thinking that probably maybe if I had that, that could have been a booster. If anything was actually going to happen, maybe I would have been back for a while before anything falls apart like it did, you know. So I'll think,
mm.
I'll say that make sure you have your vaccinations, especially when you're going to somewhere like Nigeria. Make sure you have insurance this time around if anything happens, so you can get on the
Yeah,
next flight. though
yeah,
though I had to, even though I could have done that, but I was, like I said, the superwoman in me as well. I was like, I've passed
Yeah.
the first order of the traditional wedding for my son, and I just couldn't imagine not being there for the white wedding. So I kept saying to myself, I only have 3 days, 3 days, and it was actually on that day itself that things started falling apart more until the very last day. So
Yeah.
all I can just say was that, I don't believe in luck. I was favored by the grace of God, and
Yeah.
somebody else might not be. So it's just make sure that you cross all T's and all the things that you think that you can do just to support yourself and help yourself. And obviously, always communicate with your medical team, because
Yeah.
let them know what is happening. Because I did, even before I left,
Yeah.
they knew that I was going to be away. They were on top of the game even before I traveled. Before
Yeah.
they gave me the clearance, that's why it's so strange to everybody that's why I say I think I'm a fake person, and I believe that God just wanted me to be there because I'd always prayed that for something
Yeah.
like that. So, and he just honored me and
Yeah.
allowed me. And I think I'm grateful to God. I think that's why I was being preserved, because if not, they could have found out
Yeah.
before I left, and maybe I wouldn't have been able to attend the wedding, and it would have been
Exactly.
so sad.
Yeah.
And I think it's something that I'll think of forever, because they just
Yeah.
noticed that I was losing weight gradually for almost 6 months before I traveled.
Yeah.
And I've gone for CT
Yeah.
scans, I've gone for MRI, I've for almost all the scans in this whole world, and even the nuclear medicine scan. I
Okay.
went for one just about a month before. They didn't see a single thing. So that's why I said it
Mm.
starting the day before I traveled, like that, waking up in the morning with the back, was a sign to let me know that something was lurking somewhere.
Yeah.
But there was no sign,
Yeah.
nothing. I didn't have any sparks of
Yeah.
temperature while having my dialysis, which could have been like a sign as well. There was nothing like that.
Yeah.
So, but because they know, like the day I actually came back, the day I landed, while I was in pain at the airport, and my phones were all dead, and I was waiting for the phone to charge for me to be able to call somebody to say, okay, help me, let me get home, and then go to A&E, because that's practically what I said to my mom as I was coming. I said, as soon as I drop
Yeah.
my baggages, I'm taking myself to A&E. This pain is too much.
Wow.
Not even knowing that I was going to end
Wow.
up collapsing. And I said that. And
Yeah.
as I was just waiting for the phone to charge, the call came in
Yeah.
when my phone was charged a little bit, and it was my community nurse. And immediately he heard my
Wow.
voice. He could tell that I wasn't well. And the next thing, when he
Yeah.
said, "Oh, are you back? I know you're supposed to be back today or tomorrow." And I said, "I'm actually at the airport." And he said, "Are you okay? You're not
Yeah.
sounding well." Immediately I said that. I said, "I'm
Yeah.
not well at all, John." The next thing he said, "What are you waiting for? If you're at the airport, call the ambulance." And the lady that
Yeah.
was helping me to check the phone was by my side. And I said, "Someone is here with me. She's going to do that." And he said, "Let me speak to her," and said, "Call an ambulance for her ASAP. She's a renal patient." And by the time the ambulance
Yeah.
came, I was trying to answer the questions, but I passed out while I was answering the questions. So if they
Wow.
didn't know that I was coming in and know all my steps, my plans, and
Yeah.
everything, only God knows what would have happened.
Yeah.
So
Yeah.
that's what I would say. Just make sure the
Yeah.
medical thing knows what's happening. Like now that they're planning
Yeah.
the talky stuff for me, and they already know everything. They know my movement. They know the
Yeah.
day I'm going. They know the day I'm coming back, and all that. So
Yeah, no, that's awesome. So, from the story you just narrated, it just goes to show that one needs to have coordinated healthcare, wherever you go, as you said, your medical records, the constant communication between everyone having access to your blood test results and everything just makes it a little bit smoother. And if you can afford the health insurance, even better. I guess one final question from me. Um, when you were going to Nigeria, did you have medical cover where if there was an emergency, you could be flown back to the UK?
I didn't. That's what I'll say. That I never had anything like that.
Yeah.
But I would advise it if it's
Yeah.
possible. But like I said, the Nigerian factor, you don't know. I don't know if anything like that is in place, and but because even
Yeah.
when you're going to somewhere like Europe or anywhere around, you have to shop around as well too. But especially when you
Yeah.
have like a chronic illness, or you have like a lifelong disease and all that, the insurance and
Yeah.
everything just goes up like that. But
It does. It does. It does. It does. Yeah. No. Thank you so much for sharing your journey. Um, any final words to our listeners?
just like
No.
they
Thank.
say, that know yourself, and yeah,
Yeah.
which is basically like the summary of all what we've been talking about. Know yourself, and
Yeah.
be open to your medical team. That's just it.
Yeah. No. Thank you so much for sharing so candidly and so openly with everyone. And I've certainly learned something, and hopefully all our listeners will also learn something as well.
That's
So
right.
thank you very much once again.
That's right.
Okay.
All right. Take care.